Hi, everyone. Welcome back to our channel. It is a tribe called Dhillon Podcast. I'm Angie Dhillon.
And I'm Rose Dhillon.
And I'm Malvin Dhillon.
And today we have a very special guest that is close to my heart. Joining us in the studio today, we have Dr. Inderjit Dadiala, also known as Dr. D in the house. Dr. D is a dentist. She's also the owner of Rainbow Dental Center. And a super fun fact about Dr. D. She was the first South Asian female dentist established in the Lower Mainland in Vancouver, British Columbia. Welcome, Dr. D, to a tribe called Dhillon Podcast.
Woo! Thank you so much.
You're a superstar. So, Dr. D, you were the first female South Asian dentist established here in the Lower Mainland. That is amazing. Can you tell us a little bit about that story, how that came to be?
So this story started when I graduated. I was graduated in India at the age of 21, and then I moved to Canada as a new immigrant. You had to go through all your studies. You had to write your exams. And the laws were very different. You had to write your written exam in order to show that, okay, you have what it takes, or you are a dentist from the other country. Because if you come here and you can say, I'm a dentist, it's not going to work. So you have to kind of write some sort of a written exam. So we wrote a written exam that gave me a good percent that qualified me to get into dental schools. But here in Canada, the schools were not an option. You had to challenge the national boards. So national exams were all over in Canada. So it could be in Montreal, it could be in Toronto, Winnipeg, and you had to go to those cities and write these exams. So when I started doing these exams, initially it was just clinics, pre-clinics, where you had to do show your handwork, because dentistry is all about artistry, and you had to show what work you can do. And then after that, you had to bring your patients and work on your patients in the clinics. And these exams were only in summer months when other universities were not, they were on vacation. So bringing your patient, you had to pay for the room and board for your patient. The fees were fairly heavy. And it was the time when there was a little bit of racism on brown people and sexism, like a woman, brown person doing this. So that was a big deal. And you had to fight through all those times and then go ahead and write your exams. I remember writing an exam in Montreal, and where the instructor was right beside me, and every time I would move up, I would bang into him because he was always in my space. But anyways, I managed to do my exams. It took me 3.5 years. When I finished my exam, I was about 7.5 months pregnant.
Wow.
And
Wow.
that created a little bit of, but people would come to me and say, oh my God, you're pregnant, you're writing exams. And then I would, because at that time I'd read so many Power of Positive Thinking books that I would turn it around and say, oh yeah, I tried it by myself. Now we are doing it. So I would always
Wow, that's great.
make it into that, that way. And then after doing my exams, the other fun fact is, when I started my journey, we didn't wear gloves. That was the time where no gloves were worn. So even when I came to Canada, there was no gloves. You worked in patient's mouth without gloves. And then the next exam I wrote, there was now they had mandatory recommended to do gloves. And then you had to relearn the tactile, because in dentistry, when you're working, a lot of things are touch and feel. So it just kind of became a little bit in that line. And then,
So Dr. D, you kept getting hit with obstacle after obstacle in order to become a pioneer here in the field of dentistry in the Lower Mainland. So a lot of challenges, but how long did it take you to eventually establish yourself and be the first female South Asian dentist?
You know what? I found this out years later that I was the first female pioneer dentist. I remember the College of Dental Surgeons were looking for a Punjabi speaking person, and I had to go and be part of it. April used to be Dental Health Month, and we were called to help the community or go speak. And I did go on some radio programs, and some also went on TV and talking to the public in Punjabi, because back then there was very few people that could actually speak Punjabi and connect to the elderly community.
It's amazing.
That's amazing story.
Yeah, I love it.
Thank you. Now, before we get into more conversation with you, because you got me right when you started talking about racism, sexism, and the fact that you challenged an exam when you were pregnant. These are amazing stories. I want to get into our Win of the Week segment. So not sure if you know Dr. D, but when we start off our podcast, we do an introduction and a segment that's called Win of the Week. And we just highlight something positive that happened for us in the week, or an observation. And I just we feel that it keeps the momentum of positivity going, where we don't fall into that negativity rut or where we start to complain about life. So you are our guest. Would you like to highlight a win of the week for yourself? And I know you have another win that I do want you to talk about, because we were just talking about cricket before we started.
Right. My win of the week is coming and joining you guys for this podcast, because this is my first podcast, and it's always nice to be with people that are so like-minded and positive. Right. And my other general win of the week is India won today.
Yay! Go India.
World Cup.
Yeah, so for those of you that don't know, we had an episode that came out, which is the T20 World Cup Cricket 2024. And so during the time of recording, we were saying, go Team India, go. And India at that time had just beaten Bangladesh by 50 runs and was going to be playing the following Monday versus Australia. So lo and behold, for those of you that are listening, just before we started recording, Dr. D comes from a cricket family. She's a huge cricket supporter. And we had put a call out for someone asking or to educate us on what cricket is all about. So I think now that we have a subject matter expert in-house, you can school us. But we just know that this morning, India beat South Africa to win the T20 World Cup cricket match. So hats off to you. Well done, India. And another sad thing is that Virat Kohli decided to retire.
Yeah.
How does that make you feel? Because you follow cricket.
Yes, I'm a big fan of Virat Kohli. Of course, I'm sad, but I guess he's got a family now, so he wants to move forward in his life. India was unbeaten in this whole tournament. Nobody.
Wow, really?
Didn't lose to any team.
They're like a dynasty team.
Yeah,
they had India. That's amazing.
They were a very powerhouse team this year.
Yes.
That's amazing.
I think last World Cup they won unbeaten, and they came to finals and they lost to Australia.
Oh, yeah.
So this was a good.
This was a good.
You avidly follow cricket.
Yes, I do.
Yeah.
That's amazing. Al, over to you for a win.
My win has been like an ongoing, off-going win. It's been related to renovations. I feel like the viewers are like, oh, this guy lives in renovations. And that's what's pretty much happening. When we first started the renovation in our head, we're like, it'll take us 3 months or so to just do flooring and whatnot. And then we started it and we're like, oh, we're living in this. So we can only do one room at a time, because everything needs to come out of one room, go into another room, go back. So finally, when we just left right now, the flooring guys arrived today. They arrived yesterday. They've been just doing a lot of cement leveling. So when I saw that, I was like, oh, we're getting close to the flooring, because it's been a year as of today and it's continuing. But I'm hoping by end of summer, we're going to be like 90% complete. So that's my win.
Good job.
Yeah.
Good job. And we have to apologize in advance. Al does have his phone ringer on. So if it happens to ring, it means that the reno guys are calling him, because there's a uno problemo and the roommates.
And if they don't call, that's a good sign.
Yeah. And the roommates don't have a solution. So we're putting out that disclaimer that if the ringer's on, this is why.
Yeah.
And Rose, over to you.
All right. Well, it's funny. Mine started off as not so much of a win, then becomes a win. So I'm not sure if the viewers got a chance to check out our episode where Ange talks about the fear of flying. She went into the details of like how much the aviation industry has changed. And I'm like, what are you talking about? None of these things happened to me. And then it all happened to me. Yeah. I just flew to Charlotte from Seattle, and it was wild. I mean, wild. My flight was an hour delayed. My bag was 90 minutes delayed. When I arrived in Charlotte, it was 100 degrees. And I went outside and I picked the expensive Uber because it said it was priority 6 minutes, which turned out to be 60 minutes. And I was sitting in that heat with like hundreds of people. And I'm like, just get me to my hotel. So 100 degrees weather every day. The win is I love people in the South. They're just the nicest people. Southern hospitality is a real thing. Friendly people. I made so many great connections from my work and then just random strangers at the airport. It was a really great experience. I'm really glad I went. Will I travel again during the summer when kids are off school and everyone's traveling? No, I won't do that to myself again. But I didn't. Yeah, lesson learned. But it was nice meeting the people in Charlotte.
I do remember that episode, the fear of flying episode. It's actually, it's already come out now. And I know that these two were not really mocking me, but it's almost like, Rose is very adamant. That's never happened to me. That's never happened to me. And I love when the universe punks my siblings back. And in a way where they're like, oh yeah, you're right. I think the aviation industry needs to do something about, I'm saying that I think right now that there should be a general rule where you can't muck with anybody's flight for minimum 60 days. Because I know right now we've got some friends that are at a conference in Nashville, and they just messaged me today and they said this particular airline might be going on strike. Do you know if this airline is? And I'm like, listen, I work for the airport, not the airline. Go and Google this information and leave me alone. I got a podcast to record today. So anyhow, my win of the week is really exciting. So a friend of mine, as I mentioned, is in Nashville right now. And I said, please, if you go to Nashville, can you bring me back like a cowboy hat? I want a hat. And I sent a photo and I want a blinged out hat. And I'm very happy to report that this blinged out hat, a black velvet cowboy hat, is en route to me. And I'm going to have it in a couple days. And howdy, y'all, I'm going to wear it on the podcast.
So it'd be a good prop for the podcast.
Yeah. And then I was thinking, has anyone ever seen an Indian cowgirl or cowboy? Like,
no, you could be the first one.
Then I started thinking, like, how would the conversation go down with an Indian cowboy or cowgirl in the South? And I was like, howdy, y'all. How y'all doing there? We're like, I am fine today. Why, thank you very much. How are you? Good day, sir. Like, how would that go in that whole
we might have to try it.
So I was thinking that maybe when I get the hat, that I'll channel my inner cowgirl and we'll do an episode.
I channeled my inner Southern accent and I told mom and dad, I'm pretty confident in my last life I was a woman from the South. Yeah.
I'm pretty confident I was an old soul.
I want to see you wear the Indian cowboy hat and file business center. And just cruise around.
I feel like I'm going to give away all my wins.
Every time you say hello, people just tip your hat.
And I'm going to give away all my wins because my lovely brother ordered a pair of cowboy boots for me for my birthday. So I'm going to have the hat.
You did?
You did.
I guess I did.
I guess he knows he did because I sent him the link. So anyhow, okay, that's enough. We're having way too much fun now, Dr. D. So let's get into today's segment. As I already did your introduction, you're a dentist. So obviously today's conversation is going to be leading to oral health. And I just want to put a quick little disclaimer out to all of our listeners out there. When we bring on guests on our podcast, we do it with the hopes to elevate, motivate, and inspire you to live your best life. These are conversations that sometimes get overlooked. And they're stories that we're sharing because these are important things, especially in our community. We know that a lot of people have dental anxiety. They have fear of going to the dentist. So today we want to just try and ease your tension. And if you have any sort of apprehensions about going to a dentist, Dr. D is going to calm all of your nerves on what you can expect when you go and see a dentist. And listen, we all want you to be on this journey with us for a long time. So taking care of your teeth matters so that you don't lose your teeth and that you can communicate with us. Right. And so Dr. D, I was reading this stat somewhere here, and I want to ask you this question. So I believe it was through Statistics Canada, that 40% of Canadians have some form of anxiety or fear about visiting a dentist. And get this, 22% experience extreme dental phobia. Why do you think people are so afraid of going to see a dentist?
So I think it's the fear of needle, and they're already in pain. And because they haven't seen a dentist in a long time, the decay has gone deeper, and now it's an abscess. So it's sad for women, the biggest pain is childbirth, and for men, it's a toothache. So that is
really? So, that's a great fight. Say that again. Okay, wait, let's back it up. Dr. D, repeat that. So the biggest form of pain for females is?
childbirth.
And for men?
Men is a toothache.
Wow, what a comparison.
Basically complete.
Yeah. So what we did in the past when we moved to a new clinic is we ended up having a lot of children that would come as field trips, and we would let them touch the chair, sit in the chair, give them a ride up and down, do a little thumbprint for them, do impressions, so to eliminate the fear factor. Because what we found is that when a child comes to a dental office at the age of 2 or 3, then they make their first-hand impression. But if you let them go and come in a later part of life, that means if they are 6 or 7, they've already started school, they're already hearing all these things from other students. So then they become very fearful when they come. And then there is a big, the treatment doing in their mouth is not very successful. Then they cry a lot, and sometimes the parents would say, no, just do it, hold it. But that's what I encourage, and that's why there is a first dental visit program also that you bring and show them the
That's
office.
great.
That's
Yeah,
great.
that's really
That
good.
makes
That's
sense.
really forward thinking.
Yeah.
That's
So
smart.
that really makes sense, because I think my first dental visit was to you when I was 15 years old. And I recall that. And I just had this fear. And it's funny, I can go see the doctor, but same thing for me, the dentist, I think it's the drilling sound or
Yeah.
something.
Yes. And for that, I think we do recommend to patients to bring some music if something calms them down. I also have a story of one of my patients that she was my first patient. She was afraid of dentists a lot because she was with the first clinic I was at, and she didn't have good experience, so she was very fearful. And then somehow she ended up in my office, the first clinic, the one you were talking about. And she's sitting in the chair, and she had a toothache. But the whole appointment, we sat and we talked, and she cried, and she talked about her experience, and we did no treatment, but we had a conversation with her. And now till today, I see her, and we've done everything in her mouth. We've done root canals, we've done crowns and bridges, but it's that fear. You just have to get over the fear a little bit, I believe.
Yeah. So Dr. D, how often, so let's get into how often people should be for regular maintenance, right? So how often should people be seeing a dentist?
It's recommended to see at least after 6 months to have your cleaning done and checkup done. But if for whatever reason, if you're not able to go that regularly, if there's a financial issue, then at least go once a year. Get your x-rays done, because we cannot see everything with our naked eye unless we've taken x-rays. So that's the reason we recommend to get some x-rays done and some checkup. And that way, if anything is starting, you can get it fixed, and then it is more economical than versus to wait till it becomes bigger and infected and it's painful, and then that's a problem.
Question: what's the most wildest thing you've ever seen? Like someone come that like was dealing with this kind of pain or something in their mouth, and you came and they had to do some work on it, and you're like, "This is the most wildest thing I've ever seen." So
we used to do, like I said, April was a dental health month. And one time we were participating in that. And we used to get all these patients that were booked. It was a free dental service. And we had this gentleman that come in, and he was very rugged looking, and he was so angry, and he was like a lion that's going to bite you kind of. And he was having a bad toothache, and we froze him. And when the pain went away, he became so nice. We found out he was living under a bridge. He had no home. He was a homeless guy. And, it was such a change in the behavior of that person. So it was very nice to see that. We treated his tooth, we pulled the tooth out, and he was fine after.
Oh, that's nice.
So, yeah.
Wow. Yeah, you're right, because you don't think about, there's all walks of life that people go to a dentistry from by the time you're young and old, and you must see it all.
Yeah, we do. It's like I kind of went to blank. I don't know. I can't remember. Just wait a little bit. It'll come to me.
No, that was good.
That's okay. I wanted to ask you, maybe you can just let the viewers know, how many times a day should you be brushing your teeth, and how many times a day should you be flossing?
So brushing your teeth, do a good job before you go to bed.
Okay.
So if you're rushing in the morning, clean your teeth and go to work. But at night, before you go to sleep, do a good job of brushing, flossing, because it's all the food particle that stays in between your teeth. They kind of they rot there, and the bacteria produces acid, and this acid then creates these cavities that we are not able to see in between teeth. And if you floss it regularly, you take the food out. And also I find that people don't realize that the tooth have 5 surfaces. So if you brush, you just do the front side, the inside, but in between side gets cleaned by flossing. So that's why flossing is important.
That makes sense.
Okay, I have a question for you. Traditional flossing or water flosser?
I think they both are good.
Okay.
They both have their values. With water pick, it's water pick you're talking about,
Yes.
right? Yeah, it's very effective.
Okay, good.
So and what about mouthwash? Like there's always a thing with like alcohol or non-alcohol, and I'm seeing them so much more at the store now where they're advertising alcohol free. And I'm thinking there must be a reason. As a dentist, what do you recommend? Does it matter or doesn't matter?
So the mouthwash, I used to always say to patients, don't use mouthwash because it has so much alcohol, it dries your gums. And that's the reason, the non-alcohol.
Okay.
Okay,
and then it's mine. Sorry. So I have a question because I heard on the Ayurvedic that oil pulling is something that a lot of people do. Is there truth behind this, or is this just hocus pocus?
No, oil pulling is there. I always recommend patients to do oil pulling. So if I have a person coming in and saying that, they have dry gums or they're unable to keep them out clean, the oil pulling goes in between teeth. It also, so I practice a lot of that kind of dentistry.
Holistic.
I always say, not pushing medicine only, like pills. I always give them other advice to go, like even massages or get your Epsom salt soaks. The jaw is very tight these days with the job. Everybody is doing very computer jobs or staying on the phone for long. People that are doing housekeeping, and I find they have a big problem with the tightness of their jaw. And even COVID time, I found a lot of patients came back with fractured teeth because they were clenching or grinding or they were stressing. So that created a lot of fractures. And I did a lot of crown and bridge after that happened.
Interesting.
Dr. D, right now we were talking, Rose brought up oil pulling. Can you talk a little bit about, it's because it's an Ayurvedic form of what actually is oil pulling and what type of oil you need to do pulling, and what is it pulling?
So oil pulling is you just get any coconut oil and you put it in your mouth and you swish it around, and you do it for like few minutes. You could do it for 2-3 minutes and you can spit it, or if you don't want to, you can swallow it too. It's
you can swallow it.
Coconut oil is very good for you. It crosses your brain barrier and blood-brain barrier, and it is good for you. So you can do that way too, unless you have any problems with your cholesterol and all that kind of stuff.
Okay.
Yeah.
Okay.
Very interesting.
Wow.
Good
Cool.
to know.
I had one question. When you were saying about the flossing and the brushing, what about tongue scraping? Because I find when you tongue scrape, that's like a lot of bad breath that sits on your tongue and you scrape it out in the morning. Do you recommend tongue scraping as well?
Yes, tongue scraping is, or brushing your tongue. That is recommended. And even sometimes when people are on big, heavy doses of antibiotics or something, they tend to get some sort of yeast infection on their tongue. And even I've seen cases so bad as they had mold on their tongues. Yes, you have to clean your tongue. Which is
mold, like you physically, you've seen people have mold. How do you get mold on your tongue?
It's because they're senior, there's no help, they're unable to brush them out. There is, so those reasons.
So we just want to pause it right now. We're going to take a beat. We're going to come back with Dr. D in the house, who's going to speak to us more about oral health in part 2 of our conversation. So we're going to close off today's segment. For those of you that have been enjoying the conversation so far, please go ahead and hit that subscribe button. We would love your support. Our digital family is growing and we're super excited for your support. Dr. D is going to be back with us in a couple of weeks, and we're going to talk a little bit more about the field of dentistry, get to know Dr. D on a personal level, you don't want to miss it, because I know that Dr. D's got some amazing stories in the vault. So A Tribe Called Dhillon podcast is signing off for now. We're going to be back next week. In the meantime, think about a win of the week, and we'll be back next week. Bye for now.
Bye-bye.
See you.
Bye.